Capillary refill is less than 3 seconds bilaterally. Now I'm going to check your strength. So what I'm going to have you do is grip each of my fingers like this with both hands, okay? Good. And then pull towards you and push me away. Perfect. You can go ahead and relax. Strength and resistance are strong bilaterally. Now I'm going to have you raise your arms up to the sky like this and bend at the elbows, and then go ahead and relax. Any pain or difficulty doing those movements?
No.
Okay, perfect. The last thing that I have to do for your arms is check your sensation. So what I'm going to have you do is close your eyes and then verbalize where you feel me touching you with my pen light, okay?
Left arm, left hand, right hand, right arm.
Perfect. Sensation is good on both arms. Now I'm going to take a listen to your heart and your lungs. So I'm going to start with your lungs on the front and a couple places on the side. And for that, I'm going to have you sit up where you are in a comfortable position for you. And then the way we're going to do this is every time that I touch my stethoscope to your chest, I want you to take a deep breath in and out through your mouth, okay? And then move on to this right side, okay? Good. And then this left side. Perfect. So your lungs on the front, anterior lobes sound good and clear. Same for your sides. Your lateral lobes sound clear as well, okay? The next thing I'm going to do is listen to the back side of your lungs. So if you could swing your legs off the bed for me. And then same thing here for the breaths. Every time I touch my stethoscope, in and out through the mouth, okay? Good. So your posterior lobes of your lungs also sound clear. I don't hear any abnormalities in any places for your lungs, okay? The next thing that I'm going to have you do is go ahead and get back in your comfortable laid back position. I'm going to first, awesome. And then what I'm going to do is pull the blankets up to expose just your legs, okay? So your legs are essentially the same as your arms. You're just going to also feel me squeeze. So first, skin is warm and dry. I don't feel any edema or swelling. I'm going to feel the 2 pulses on each foot, okay? Dorsalis pedis pulses are +3 and strong bilaterally. We're going to go to these ones behind your ankles. Posterior tibial pulses are also +3 and strong bilaterally, looking good there. Next thing I'm going to do is squeeze all of your toes just like I did your fingers, okay? Good. Capillary refill is less than 3 seconds bilaterally. The next thing is the strength and resistance. We just do it differently for your feet. So what I'm going to do is place my hands on the tops of your feet, and I want you to pull me towards you, okay? Good, good, good. And then press down. Perfect. Go ahead and relax. Strength and resistance is strong bilaterally. Excuse me. The next thing we're going to do is range of motion. So what I'm going to have you do is pick up this right leg and then bend it at the knee and relax for me. Same thing on the left. Pick it up and bend at the knee and relax. Any pain or difficulty doing those movements?
No.
Good. Full active range of motion for bilateral lower extremities. The last thing that I have to do is the sensation. So again, you'll close your eyes, no peeking, and then tell me if you can feel where I'm touching you, okay?
Right leg. Left foot. Left leg. Right foot.
Perfect. That looks good. So we're all done here. I'm going to cover you back up, okay? That concludes the assessment portion. Did you have any questions?
No.
Okay. Everything looked really good.
Side of your chest, move your hair. It is even and symmetrical. No redness or anything that I see present up here. Breathing is symmetrical. You're not using any accessory muscles to help you breathe. So now I'm going to listen. Starting at the apices. Alright, if you can. Thank you. Perfect. So now if you can just lay back, I'm going to count your respiratory, so just lay back and just breathe normally. Alrighty, in 15 seconds, there was 4 full respirations, so I'm going to times that by 4. 16 respirations per minute. So next I'm going to listen to your heart. So I'm going to start off with the diaphragm. Start with the apical. S1 and S2 present. Pulmonic. S1 and S2 present. You can lift them, please. Listen for the tricuspid. Alrighty, mitral. S1 and S2 in both. I'm going to flip it to the bell. Work my way backwards. S1 and S2. S1 and S2. S1 and S2. S1 and S2. So now I'm going to listen to your heart rate and count. Alrighty, so it's 16 and 15 seconds, so 16 times 4, 64 beats per minute. Alright, so next I'm going to have you sit out, and I'm going to test your range of motion and grip strength. So first I'm going to test it in your hands, so if you can squeeze my hands for me. Alrighty, that's a 5, and if you can, try and spread your fingers. 5. Now I'm going to test your wrists, so up, down, side to side. Perfect. And then can you have your arms up and then pull towards you? Alrighty, push. Alrighty, that's a 5. Shoulders lift up. Perfect. That's a 5. And so now I'm also gonna have you, for your elbows, do supination, pronation, and then for your shoulders, you lift it up to your head, down, forward, and then square behind you. Alrighty, full range of motion in the upper extremities. All parts of the body is graded out of 5. Alrighty, so now I'm going to have you lay down and I'm going to check your abdomen. So as I'm inspecting the abdomen, there's a birthmark in the right upper quadrant. Everything's flat, smooth. Yep, everything's flat, symmetrical. The umbilicus, there's no lesions or hernia or any discharge in that area that's present. So now I'm gonna listen. Start in the right lower quadrant. Vowel sounds are normoactive in the right lower quadrant. Normoactive in the right upper quadrant. Normoactive in the left upper quadrant. Normoactive in the left lower quadrant. So next I'm going to do palpations. So I'm going to start with the light and then go to deep. The light one, circular motions. Feeling for any tenderness or masses. So if anything hurts, just let me know. Right now there's no tenderness present. I don't feel any masses. Alrighty, I'm going to go into deep now. Alrighty. Everything feels good. Perfect. So now I'm going to look at your pulses. So first I'm going to start off with the radial. Alright, they're equal bilaterally 2+, brachial. Equal bilaterally 2 pulse, 2+. Next I'm going to check the capillary refill in your fingers. Alrighty, they all came back in less than 2 seconds. So now I'm going to ask, this is the part where we do the femoral pulse. Would you like me to do that today or no?
No, thank you.
No, so the way I would do that is I would feel for the pulse in the groin area, make sure it is even, and it is like a 2 pulse, 2+ pulse. But another way to make sure that is good is to check the lower extremities. So that's what I'm going to do next for the pulses. Next, I'm going to check the back of the knees. Pulses are equal bilaterally 2 pulse, 2+. Alrighty, equal bilaterally 2+. Equal bilaterally 2+. Alrighty, so since these were good, I know the femoral pulse is good. Now I'm going to do capillary refill, the toes. Alright, they all came back in less than 2 seconds. So as I'm inspecting the legs, there's no redness or patches of different colored skin. There's a couple bruises on her shin. I'm going to feel the temperature at the back of my whole hand. Her skin is cool. It's not wet or anything like that. Can you sit your feet up a little bit so I can look for any varicose veins? No varicose veins are present on either side. And sit it down, put your legs back down, please. Test for edema. No edema present, a grade 0. Now I'm going to inspect in between the toes. Alrighty. And the soles of her feet. Perfect. No abnormalities, lesions, or any blistering in her feet. And the hair distribution on the leg, there's no hair. So next I'm going to do the range of motion for the lower half. So if you can, put your knee to your chest one at a time. Good. Now put it to the side. Good. You can.
For respiratory excursion. So to do this, MJ, I'm going to place my hands right here, and I'm going to check for symmetry. I'm going to have you take a deep breath for me. Perfect. So I'm looking at my hands to rise equally. So I'm going to do this anterior and posterior. Okay. I'm going to have you take it. Perfect. So I put my hands like in the 10th rib, and my hands rose equally. Now I'm going to palpate for any costochondrial tenderness. So I'm palpating. Do you feel any tenderness, MJ? Okay. And then next I'm going to palpate for the fremitus, the tactile fremitus. Okay, so I'm gonna have you say 99 every time I place my hands on you.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. So I'm checking for resonance to make sure it's equal to vibration, which it is, equal bilaterally. So now I'm going to go ahead and percuss. So to percuss, I'm going to use my middle finger, and I'm going to use the distal portion, and I'm going to tap with my other middle finger, okay? So I'm just percussing. I'm going to start here. And I'm checking for any dullness. And I want to do this anterior and posterior. And while I'm doing this, I'm going to actually do the diaphragmatic excursion. So to do this, I would do both sides bilaterally. And I'm going to have you take a deep breath in, and I would percuss downwards. So MJ, let me have you take a deep breath in and hold it in. Okay, so I would mark it. So pretend like I mark it right here. Okay, and then now exhale and hold it in. Perfect. Hold it. Okay, so this is the diaphragmatic excursion, and it should be less than 3 centimeters, or between 3 and 4 centimeters. So yours is normal, and I would do both sides, and I would check the diameter to make sure the diaphragm is equal. So after I've percussed and I've done the diaphragmatic excursion and I've percussed the anterior portion as well, I'm going to go ahead and auscultate. Okay, MJ? So I'm going to use my stethoscope, and I'm going to, do you want to sit sideways? Okay, so every time I put my stethoscope on your chest, I'm going to have you take a deep breath for me. Okay, and I'm going to start at the apices of the lung. Okay. So I'm at the apices of the lung. Deep breath. Sorry, let me start here. And I want to do the right lateral and left lateral because I want to listen to the middle lobes, and that's in the 5th intercostal. So let me have you take a deep breath. Okay. I'm going to do the posterior now. Take a deep breath. Perfect. 100. So I was checking to see if I hear any adventitious sounds, any wheezes, crackles, any coarseness, which I don't hear. All lung sounds are clear.